Hi, I'm Will Carroll from all22.com. I write about injuries, so let's talk about the big one on the day. Ben Roethlisberger, certainly a tough break for them, but it could be not nearly as bad as people are letting it on to be. Ben Roethlisberger due to have surgery on Monday morning. My sources tell me that is happening as we speak. So what happens next? Uh, let's first understand the injury itself. That would be a lateral meniscus tear, or excuse me, medial meniscus tear on his left knee, medial meniscus tear, left knee. They're going to go in and do what's called a mini trim. They're going to go in. It's a small disc. They're just going to cut off as little of it as they can. They're hoping they're not going to be able to do anything. Sometimes you'll see this described as shaving the meniscus a little bit, but all it's going to take, they're not going to open the knee up. This is completely arthroscopic. They're going to put in basically two sticks. They'll jab them in. One will have a camera so they can see it. The other will have a small little burr, and that's what's going to take it right off. Now, the trick to this is taking as little as you can. Obviously, he's going to have a great surgeon with a lot of experience with this. Then, when he comes off the table, that's when things will start to get interesting. And we'll know as soon as Wednesday how quickly they're going to be trying to get him back. If we see him at practice on Wednesday, not practicing, but just walking around, 48 hours after surgery, that'll be the signal that maybe they're thinking about this Sunday. So here's what they'll do in the interim. First thing they're going to do is try to keep the swelling down. That's fairly easy. They'll use compression. They'll use ice. There are a lot of devices they can use to do this, but mostly they're just going to try to keep the swelling down. If they can keep the swelling down to the point where he can get some weight on it on either Monday evening, Tuesday morning, very good sign. By Wednesday, they'll be able to check the stability and let him walk around more significantly. Again, that's where I think we're going to get a real clear indication on where they think he's going to be and when they think he's going to come back. Because I think Wednesday's really the key on where they go with this. If by Wednesday they have the indication that maybe he could play, I think they play towards that. They can always bail out right up to game time and say, you know what, you're not playing Ben, we're going with Landry Jones. But I think if we see him on Wednesday, then we're going to start seeing more of a progression. Certainly they're going to be very careful. They don't want to have a setback. They don't want to have it re-tear. And that's the big worry as far as injury. That they're not repairing the meniscus. Even if you hear this word, this is not what they're doing. They're trimming the meniscus. So there's nothing that come undone. It could re-tear, yes. It could have a bigger tear, a different tear, but it's not going to unrepair. So that's less of a risk. You're going to see him back at practice late in the week. You'll see him moving around. Like I said, at any point they could quickly rule him out. Remember, they have the bye in week 8, which certainly gives him out. A question from Justin: I'd hold him 2-3 weeks minimum still. See, again, I know people are saying this, but there's really no medical reason for it. There's a lot of players that come back in 2 weeks, but of course there's no game in 2 weeks. There are also a lot of players that come back a lot quicker than that. The question is going to be whether they can keep the swelling down and whether it can be weight-bearing without that swelling by really Friday. Can he move around? This is entirely possible. I'm not saying it's probable. Right now, I'd say it's at best 50-50. It could happen. So one of those things where we're going to be watching very, very closely to see certain signs. Again, I think the best sign is going to be whether he's weight-bearing at all on Wednesday, whether he's back at practice by Friday. We've seen Roethlisberger adjust before. After his head injury, his motorcycle wreck, came back and had almost no problems, was back significantly earlier than most people expected. Previous knee injuries, he came back, was able to kind of play through them, got very stationary, but he's not that mobile a quarterback to begin with. I think By late Friday, the Steelers will have made a decision. They'll say, you know what, this isn't going to happen. Let's take that bye week and go with it. Then Landry Jones goes. That's going to be an interesting one because it's a big drop off between Roethlisberger and Jones. Jones is getting more of the reps in practice this year. Last year, when he came into the game, it was after not only Roethlisberger was injured, but after Vic was injured. Jones is getting those reps these years, so we're going to see that going. Why didn't they have a third quarterback active? Most teams don't these days. There was a question there. Sorry, that just lots of them going there from Robert. Why aren't they getting Mecklenburg? Mecklenburg's been beaten out. This is one of those things that I think a lot of people don't really grasp. Third and project quarterbacks don't get a lot of reps. They get a lot of reps in the fall at training camp. Once games start, they're secondary until there's an injury. So it's one of those things where Mecklenburg has kind of shown you what he is. He was a live arm. He was available. So think of him like Landry Jones last year, a guy they really don't ever want to have to play. They don't invest very much in backups because Roethlisberger has shown himself over and over to be very, very durable, and the drop-off is just so significant. If Roethlisberger's not out there, they're probably not going to win. You combine the two, and there's not a whole lot of reason to invest. You put the money into Le'Veon Bell, you put the money into receivers, and those are positions where they've shown over and over they do need the depth. If you have any questions about Ben Roethlisberger's surgery, again, he's having the surgery as we speak. They're doing what's called a mini trim on his meniscus, taking off as little of the damaged meniscus as possible. He should be, it's a very, very simple surgery. Experienced surgeons can get through this in about 30 minutes. He will have general anesthesia, so sometime this afternoon he'll probably be moving around. He'll start to have some weight bearing once he's awake and stable. So it's one of those certain situations. Can I fix the defense, Antoine? No, sorry, I can't. But I don't think there's a whole lot to fix right there. So let's see. Why wouldn't you wait? This comes down to a medical decision and a football decision. Would putting him out there damage any further? Certainly you wouldn't put him out there if it did that, so they're going to have to make a decision. If you're going to have a situation where he's not mobile, you wouldn't put him out there. They're going to make this decision based on medical and the football ability. But to do that, you're going to need to see him out there. And again, so you're going to have to see on Friday. Terry says, Jones is not qualified. What were they thinking when they didn't get a backup? Again, they've seen Jones play. They know he's at least capable of playing quarterback at the NFL level. There weren't a whole lot available. They went out and got Mecklenburg, so I think they certainly recognized they could possibly upgrade the position. They certainly have a type. They went for Vic, which was against type. I don't know who the heck you would go get. There's not a whole lot of quarterbacks out there. Let's see. Douglas asks, is Big Ben out for the year? No. If you didn't hear before, there's a chance he's back for week 7. I don't want to put a percentage on it. I'm just saying there's a chance at this point we'll know. We'll get a good indication by Wednesday, and by Friday we'll definitely know. With the bye in week 8, I think it's certainly going to tilt things. It gives him a chance to give him essentially a full 3 weeks before he comes back. So we'll see where that goes. Let's see. A lot of people calling for Tim Tebow as a quarterback. I think people were asking for a good quarterback, someone who could actually play the position rather than somebody who's playing around at being a baseball player. Peyton Manning's not returning, so I don't think that's another option. So not sure exactly. Jill asked, what if it is torn all the way through? It's not. They've already done the MRI and they got a good look at it. And yeah, there's always a chance there's another tear in there. But if so, they're going to do as little as possible during the surgery. Just trim it away, get the knee to stop locking up, get it back out there. So we'll see where that goes. Again, any other questions? Awesome. Again, let's summarize. Roethlisberger having surgery as we speak. Heck, could be done by now. He'll have a quick rehab, have almost no issues with that. Look to see whether he's walking around at practice, not practicing, but just walking. If we see pictures of him walking into the complex, that's a great sign on Wednesday. Look for him practicing by Friday in some light capacity. That would be a sign, and I think they'll make that decision on Friday. With the bye in week 8, if he doesn't play this week, that means 3 weeks before he comes back. So, again, thanks to everybody for watching. Follow my work on All 22, and we'll definitely be watching how Ben Roethlisberger is coming back in those columns. Thanks a lot.